Recent report you might have read had to do with infant mortality rates and the recent statistics therein. The published report suggested the rates are going up in Calhoun County, and now we have a group of folks who are here to say, no, they're not. Jill Wise is here from Grace Health, and Michelle Daetema is here, the co-chair of the Maternal Infant Health Commission, and Jennifer Van Valkenburg's here from Regional Health Alliance, all to talk about that. Good morning, ladies.
Good morning.
Thank you for being with us today. So somebody set the scene here, if you would, with the situation as it relates to infant mortality. This is something that is closely watched county by county. And where has Calhoun County been?
So infant mortality is the number of infants that die before the first birthday.
Okay.
And so in 2000, it became known that the infant mortality rate was higher than the state average, and so there's been a lot of work done now. The kind of dates we're comparing now, 2008 to 2010, the infant mortality rate in Calhoun was about 10 per 1,000 births.
Wow.
And then in 2013 to 2015, it's dropped down to 7, and below the state average. So we're really excited about that, and it's been a lot of work that's gone into that.
Mm-hmm. What accounts for this problem?
Lots of things. So if you think about the three main causes, so that would be the kind of thing that would show up on the death certificate. It's babies born too early, babies who have some unsafe sleep, so are suffocated while they're sleeping, and babies who have birth defects. So those are the causes.
Okay. And in Calhoun County for a while, we were above average on that.
Mm-hmm.
And so what accounts do you think for the change? Anyone?
Well, in 2000, actually, the Maternal and Infant Health Commission was formed, and that group is a community partnership around improving infant mortality, and we have a group of over 20 partnering organizations working together collaboratively so that babies are born in Calhoun County healthy and thrive.
Mm-hmm. So is this simply a matter of education about, for example, how a woman who's expecting needs to see the doctor regularly and adopt some other habits? Is it as simple as that?
I think education is a part of it.
Okay.
I think for our community, the first step was to determine where the problems exist. Where is education lacking? Where are resources lacking? And what can we do to connect pregnant women to those resources and to that education? And so that's what collaboratively we've been able to do. We've been able to say, this is the message. Let's be sure that everybody's giving the same message. Let's be sure that it's clear, simple, and that it's consistent, that they're getting it many, many times throughout pregnancy. So now that we have the messages kind of developed and we have the people and the organizations working together around that, we need to continue to get the message out to pregnant women and everyone else. Because if you even watch a baby, if you're in child care, if you're a grandparent or anybody can impact the health of babies, and anyone can impact the health of women, which ultimately impacts pregnancy outcomes, which of course impacts infant mortality.
Right. So the published report in the Battle Creek Inquirer gave the impression that the statistics are going up, and you have quickly retorted and said, wait a minute, no, they're not. So is this just a matter of how you interpret the statistics? What's happening here?
So the data that everyone uses comes from the Michigan Department of Health and Community Services. Mm-hmm. The data is collected from birth certificates and death certificates, and we look at it 3 years in a roll. You can't a rolling 3-year average.
I see.
So when we look at the data, that's what we're seeing. You can interpret data maybe before it's been assigned to a specific area. So I think that's part of what happened with the Battle Creek. They got the numbers, but then later they do some what's called geocoding, specifically where did that baby live. They might have had a Battle Creek address, but it might not have been living outside of Battle Creek.
I see.
So you have to make sure that you're interpreting the data from year to year in exactly the same way. So when we look at the data that you can get on the Michigan Department of Health and Community website, and it's available to everyone, we definitely see a trend starting with 2000 and continuing to drop below the state average.
So how do we keep that going? What's the best thought about how this is impacting the statistics?
Well, a collaborative community approach really is needed on an ongoing basis. We have new babies being born every day, and so we have new parents who really need support, and we want to help them. We really are striving to ensure that every baby is born healthy and thrives, and so we have different initiatives that have taken place in this community to support infants and families. We have the Calhoun County Pack and Play program, which is an example of one of those initiatives where any child who needs a safe sleep environment has the opportunity to receive a pack and play.
Okay, and Grace Health is involved here because Grace Health is the go-to healthcare provider for a lot of folks.
Yeah, Grace Health, we perform about almost 600 births a year, which is about 70% of the births in Battle Creek. So because we see so many of those pregnant women, we are a good resource for them. We get them connected to not just prenatal care, but we try to get them connected to the resources that will help them be healthier and basically change their habits. Start to practice safe sleep practices. But they have to know that information before they can change habits. So that's a large part of what we do. We provide a lot of resources and supports around everything from prenatal care to breastfeeding to safe sleep. We connect them to a lot of the other organizations in the community that provide services that we don't. So when it comes to maternal and infant health, agencies recognize that they are not the one and only, but in fact the best approach is a collaborative approach and one that completely surrounds the women with all available resources. And so in an effort not to duplicate resources, we at Grace Health do a lot of referrals out, and we get a lot of referrals from our partner agencies as well, such as the health department, the hospital, all the agencies that we work with, a lot of the home visiting services in the communities, so that, the nurses and social workers are actually visiting pregnant women in their home. There's just so many resources in our community. We're very fortunate that way, but we have to connect the women and the families to those resources.
We're talking about the latest infant mortality rates that are being analyzed. Jill Wise is here from Grace Health, and Michelle Daetema is the co-chair of the Maternal Infant Health Commission, and Jennifer Van Valkenburg of the Regional Health Alliance. So the commission, Michelle, what is that about? And I presume this came together as a result of these numbers, but talk a little bit about that, if you would, and how this aims to help further.
So the Maternal Infant Health Commission is an issue action group of the Regional Health Alliance, started in 2000 to specifically address those numbers. And we have a large group where we meet together and talk about the big picture, and that's kind of where we have that big collaboration. But we also have work groups. So we have the Pregnancy Care Work Group, where their focus is a coordinated care, and so that everyone is getting the same message around safe sleep, breastfeeding, education during pregnancy. We also have a breastfeeding coalition. So infant mortality is not just babies who die immediately after their birth. So breastfeeding is very, very helpful. We have a home visiting hub, as Jill mentioned. Nurse Family Partnership, which is the program I manage, works with first-time moms. Grace Health has a maternal infant health program that can serve Medicaid moms. And so home visiting is really a strong piece of that. We have the FEMUR, the Fetal Infant Mortality Review, so looks at these specific deaths. So there's just, the numbers are definitely getting better. It's really a collaborative piece, and ways people in the community can find out more is to go to the Born to Be Healthy website, borntobehealthy.org.
Okay. And how about the Regional Health Alliance? How does that group play into this whole effort?
Well, the Regional Health Alliance is a community partnership to improve health and well-being in Calhoun County, and the Maternal and Infant Health Commission is one of our issue action groups addressing maternal and infant health. And maternal infant health has been a top priority since 2000, and really is one of the priorities that the Regional Health Alliance started working on immediately.
All right. Well, I do recall when I worked in Kalamazoo County, this was a constant focus as well, and now it certainly is here too. Is it fair to say, though, that these numbers fluctuate by population? So I presume if we went to Wayne County, for example, the numbers would be higher. Is that fair to say?
Certainly they're higher in some counties are higher, some counties are lower.
Okay.
You mentioned Kalamazoo.
Yeah.
One thing that we're doing is there's a regional approach. So all the counties kind of down in that, from Kalamazoo and Calhoun down into Berrien, the little corner of the state down there, working regionally on some things to impact infant mortality. We're considering safe sleep. We're considering substance abuse. We're considering access to services. So being able to expand that beyond and make there's an impact for the numbers as a region.
Right. So that's interesting you bring this up, because there's probably some tentacles to this problem that you have to address. You talked about substance abuse and other things that interfere with these numbers, don't they? So what do you do then? You have to focus on treatment programs and things and try to make those resources available too? How does this work?
I think the key for us to address this issue locally is to understand where the issues arise. Why are infants dying, and what are the factors associated with that? And that's what we do when we come together. We come together and we look at the facts, and we say, this is what's missing in our community. This is what education we need to get out there. This is where we need to put resources. So it allows all of our work to be very strategic and very data-focused so that we can have an impact on the real problem. That's why it takes everybody, because we can't all address every single issue that really makes up this very complex problem.
Right.
So it takes all of us to do our part. So that's why we need all of these organizations to come together, and we've all done something. We've all implemented a lot of things over the last several years, and that's why we're seeing an improvement, because we're addressing the very real issues for the people in our community, and that's what it's going to take for us to continue this work. We need to continue to come together. We need to continue to look at the data, and we need to continue to develop strategies that are very specific toward the very issues that our community is basically experiencing.
All right, so somebody's listening to this, and maybe there were resources they didn't know were there. How do they get to them? Anybody?
So there's the borntobehealthy.org website, which is a wonderful resource of information for women, moms, families. It has all of our maternal and infant health resources in the community that are available right there. And so that's a great place to start. And if there's an interest in being involved in any of our groups, we have a very robust and active community of folks that are very passionate and caring, who want to help and help babies grow and thrive. And so if you have an interest in being a part of any of these efforts, you can contact the Regional Health Alliance at 269-962-2181.
2181. Okay, very good. And I presume that if someone comes to Grace Health and as you said, 70% of the babies are delivered at Grace Health, they're going to get connected to this information just by virtue of being there.
Yeah, I like to think that when it comes to this issue of pregnancy care and infant care, there's no wrong door in our community. So many of us are working together on it that if you were to go into the health department, if you were to call Grace Health, if you were to get online, if you were to call the Regional Health Alliance, we're going to get you connected to the services that you need. And if you absolutely don't know where to go or you forget, call 211 and they will get you connected as well.
Information helpline 211. All right, thanks to all of you, and we'll be happy to stay in touch on this issue.
Thank you so much for having us.
All right, thank you.